Welcome everybody, welcome my optimal minds. Today I'm going to talk about how to do exercise with an ADHD brain. Not necessarily like how to do exercise. Everybody knows how to do exercise, but like how to do it with an ADHD brain, because as you probably know, just like with any of us who have ADHD, it can be really difficult to remember to do exercise or fit it into our schedule. So therefore, we don't end up doing our exercise on a daily basis, or at least 5 days out of the week, or even 3 days out of the week, because we get distracted so easily. Sometimes the exercise just gets pushed to the side. And with that being a problem, this could be an issue for our health. And not only that, research has shown that a lot of people with ADHD tend to, especially adults, as we get older, tend to be having more weight issues. And a big culprit of that is because we tend to have a difficult time remembering or putting in our schedule to doing exercise, or because we didn't accomplish anything else or didn't finish what we were supposed to that day, the exercise that we're supposed to do that day got pushed off the table. Okay, so let me kind of talk about some strategies to implement as far as these exercises. I want to talk about probably 3 different things as far as what you can do as far as strategies to make sure that you're doing exercise. But let's first talk about the importance of exercise and why it is so important to implement exercise in the first place when you have ADHD. Well, what exercise does, not only, great, we can lose weight, we can look fit, we can look young and great, all the great anti-aging properties. But what about for ADHD? How is it benefit to ADHD? Well, typically the big benefits is really the hormones, as well as the different types of brain chemistry that does balance. So what I mean by this is specifically serotonin and dopamine, and also epinephrine and norepinephrine, which are stress hormone regulators. So when you're doing consistent exercise, both combo of cardio and strength exercise, HIIT exercise, can really help balance these types of neurotransmitters, as well as the different hormones that can help stabilize our mood. Because a lot of people with ADHD tend to have high anxiety, they can have depression, they can have PTSD, they can have definitely bipolar disorders. There could be a combo of lots of things with people with ADHD. So exercise is certainly something that you should be implementing on a daily basis, or at least 5 days out of the week, and really use it as a priority. So the very first thing that you should understand is educate yourself about how it's important for the brain, not just how is it important for losing weight and having for all the other health benefits, but really educate yourself of how it actually is important for the brain. When I started doing this motivated me more, especially as I'm getting older, I have kids, I have more responsibilities. It makes it difficult to fit in the schedule of exercising. Now, when I was young and single, it was easier to fit in exercise. But now as you get older as an adult, and this is why they have found with adults with ADHD, tend to have more health problems, especially with weight, because they don't implement exercise. But if you switch your thinking, okay, well, maybe there's a benefit more to than just losing weight when I exercise. It benefits the brain significantly. And if you have more of that motivation of understanding when you exercise, it's really benefiting your brain, because what it does, it also helps you focus throughout the day. That is kind of more my motivation factor of actually doing exercise on a daily basis, so that I can have a focused and optimal mind throughout the day, so I could be more efficient with my time, and also that I could be very productive throughout the week. Okay, so that's the first thing, is really just kind of educating yourself about how the importance of how exercise can benefit your brain. The second thing is about prioritizing. So you have to put it in your schedule. If you don't put it in your schedule, it'll be missed. You have to put it in your schedule. And what I recommend, and I've talked about this in previous videos, is after you've done your 3 big things, right, at the beginning of the day, you block that out and you do the beginning of the day, because that's where your willpower is. Remember when I talked about willpower, the importance of willpower and your willpower being depleted throughout the day, especially with us people with ADHD brains, because we get distracted all the time. The more we get distracted, our willpower meter depletes even faster. Okay, so by doing it after your 3 big things that are important tasks that you need to get done at the beginning of the day, do it right after that. Use it as a break, because your willpower meter is still decently high. And usually when you get motivated to do exercise, you need your willpower meter to be high. Okay, so definitely do it more at the beginning of the day. The third thing that I'd suggest as far as a mental trick to help you remember, but also to even be motivated to do the exercise, because people with us with ADHD, sometimes we lack in motivation. Sometimes we lack in really remembering to even do the exercise in the first place. So a trick to do, and this is what I've talked about before as well as doing tasks, is to tell your brain that you're only going to do 5 minutes of running. Just be like, okay, I'll do at least 5 minutes. I could do 5 minutes. 5 minutes is fine. Because if you do that, if you implement just doing 5 minutes of exercise, by the time you get your shoes on, you get your clothes on, and you're starting to run, you're like, well, might as well just run for 30 minutes. It's just a little trick that you can implement to really get the gears going as far as exercising. Okay. The other thing is also to make sure that we're not forgetting to do the exercise is going back to the prioritizing. Okay. And what I mean by that is when you are putting it in your schedule, you have to make sure that the time is blocked out. Because if you don't block out the time for the exercise, it's not going to happen, right? And I wouldn't encourage you to do it at the end of the day because your willpower meter will be depleted. It'll be depleted, and therefore you're not going to have the motivation to want to do the exercise, and so it doesn't end up getting done. This is what happens with me all the time. If I do my exercise, like put it off to the end of the day, a lot of times I'll have my willpower and motivation to do it is very small. So the chances of me doing it more at the end of the day is very low. Versus what I usually will do is either I'll do it after I do my 3 big things first thing in the morning. So, usually like 10 o'clock, maybe 11 o'clock, we'll go for an exercise. Now I try to do both. I try to actually go do a run and sometimes also do a strength exercise. So what I'll do is in the morning do one, and then that's a little mental break for me. And then midday, about 2 o'clock, my motivation meter's still, there. I still have that little willpower. Then I will actually go do maybe a strength exercise or go running. Then what that does for me, it really helps me with my focus to finish the rest of the day because I got the exercise done. Now the other tasks that I had for later the day, whether it's seeing patients, whether it's working with clients or producing content like this for you guys, it just really depends on what's happening that day. But at least I have now a little bit more mental clarity because exercise helps really balance those endorphins, helps really increase the dopamine and serotonin levels. So that way I have more of a clear, focused mind throughout the day. Okay, so but don't put it off at 5 o'clock, 8 o'clock, certainly not 8 o'clock because that can disrupt your sleep. So these are the tips, I suggest as far as what you should be implementing to really help you do exercise with an ADHD brain and be able to implement it even more frequently and understand the motivation behind it. Okay, so but if you are looking for additional help as far as if you really want a more focused and sharp mind, well, I have a free training that goes over my proprietary process that help my clients and patients who have ADHD. This is for both training for adults who have ADHD as well as parents who have kids with ADHD can watch this. And it's in the description below, and you can watch that there. Okay. So until next time, this is Dr. LeGrand signing out. And remember, you have an optimal mind. Thanks. Bye.